Good afternoon, everybody, and welcome to today's virtual lunch meeting. My name's Sam Chikoski. I'm the Sales and Marketing Manager for the JCN. I'm just going to run through a couple of bits of housekeeping before we get started with today's session. So today's session is titled Changing the Landscape of Continence Care, and our speakers today are Lindsey Edwards, who's a product specialist at IQ Solutions, GBIS and Incontinence Care, and Ashley Clydesdale, who's a product manager HMS Marketing UK at Essity. Today's session is sponsored by Essity, and there will be certificates available for you to download at the end of the session to go towards your revalidation. We will have a live Q&A at the end of the session today, so do submit any questions in the text box and we'll get through as many of those as possible at the end. You will be able to download today's slides and watch the video back in the next few days. And that's all from me. I will now pass you over to today's speakers, and I'll see you at the end for the live Q&A. Thanks very much.
Thanks, Sam, and thank you for joining us today for our virtual lunch meeting, TENA SmartCare, Changing the Landscape of Continence Care. In a session today, Lindsey will explore how the health system has embraced digital technologies in recent times. Some of the catalysts for this rapid advancement will be identified, and she will discuss how the delivery of care has changed as a result. She will look at the detail into the care continuum, explaining what it is and how digital technologies will assist. We will then take this opportunity to introduce you to some of the TENA SmartCare innovations that we are launching in the UK this year. We will demonstrate how some of these new innovations will support and enhance the delivery of continence care. So I'll hand you over to Lindsey.
Thank you, Ashley. So the world we live in is changing, and the demands on health and social care are changing with it. There's approximately 400 million people worldwide, and the population is ageing. Reports indicate that the ageing population present with an increase in dementia. 70% of these individuals will live in care homes. Before the global pandemic, the World Health Organization reported that there is likely to be a workforce shortage of 14.5 million across health and social care by 2030, with the UK government estimating an 8% workforce gap across this sector. A Skills for Health report conducted as recently as August last year indicated a vacancy rate of 8.2% across social care, and this is likely to be higher as a result of Brexit and the impact of the pandemic, and more recently the introduction of mandatory COVID vaccination status, not to mention the impact of the latest Omicron variant and its infection rates affecting staffing numbers. As the number of people infected by COVID increase, as does the need to self-isolate, and we see daily reports on the news discussing the impact of staff absences. These absences can mean that some care homes are unable to safely fill their beds, leading to people staying in hospital much longer. The Prime Minister and the Health Secretary called on retired health professionals to return to the wards to backfill vacancies, and the variant has seen over 20 NHS trusts declaring critical instances due to poor staffing numbers. As a result, as recently as yesterday, we see the military are supporting ambulance crews to ease the demand. The unknown around COVID, together with the expected winter pressures, puts a strain on the NHS and social care like nothing we have seen before. The inability to discharge into care home beds has seen patients being discharged home to the care of their family members who have limited access to social care packages and support. So in essence, there is an increased demand on health and social care with less staff to meet the needs of the population. Some of you may be familiar with the NHS long-term plan, and it highlighted the need for digitalisation. The plan stated that making better use of data and digital technology, we will improve and provide more convenient access to services and health information for patients, with the new NHS app as the front door. Better access to digital tools, patient records, and improvements to the planning and delivery of service based on the analysis of the patient and population data. Despite its inclusion into the NHS plan, the move to digital was relatively slow until the pandemic hit. The NHS had to react to the effects of COVID-19, and many staff were redeployed to meet these demands. The drive to keep the NHS open forced a swift move to embrace aspects of the digital world to ensure continued service and delivery to patients. The stay-at-home guidance saw an increase in demand on some services with a reduced workforce to meet this demand. We saw telephone consultations commenced and many face-to-face appointments moved to digital platforms like Zoom or Microsoft Teams. Although this was initially greeted with some concern, many members of the public embraced the flexibility it offered. The last 18 months have seen these platforms remain firmly in place, and some cases, these are now used for initial assessments where clinical need allows. More and more people have downloaded the NHS app, and we use it to book GP appointments, order medications, as well as logging our lateral flow test results and accessing our COVID passports. So out of the initial reluctance to move to digitalisation, the NHS has now embraced it and can see the value of its inclusion across the NHS and its value to the patient. So you may wonder why TENA are bringing digital solutions to the market. Well, as we've discussed, the world we live in and work in is changing, and the use of digital solutions are entwined into our daily lives. So we need to adapt, and we want to continue to support healthcare professionals, carers and end users. At TENA, we would normally come into contact with people at the latter stage of the care continuum, often when someone is in receipt of social care or maybe living in a residential or nursing home. However, as a result of the workforce shortage and the impact of the pandemic, people have been contacting us much earlier along the care continuum, asking for support, help and advice. The care continuum can start for many of us approximately 7 years before someone may require 24-hour care or a move into long-term care. This support may begin with us being asked to do small tasks on a regular basis for our parents, elderly relatives, or even our neighbours. These can vary from providing a taxi service to appointments, or shopping, or even ordering medication, before we need to move into more labour-intensive tasks like laundry, cooking and cleaning. The shift in this support can be triggered by a physical change, following a fall, for example. And it is at this point that we find ourselves in a position where we're trying to care whilst holding down full-time jobs, caring for our children, and generally trying to keep all our plates spinning. It is at this stage that we at TENA are now able to provide support to caregivers via our digital solutions. And we are pleased to present our TENA Family Care app. And here is a short video.
So the video has just demonstrated some of the functionality of the TENA SmartCare Family Care app. One of the key benefits of the app is to help networking and communication to support the delivery of care for that loved one in the community. It gives a facility to spread the workload, in effect, sharing the care. As Lindsey has highlighted, due to the increasing demands that are being placed on the health and social care systems, such as ageing population, vacancy rates, absences linked to isolation, more and more of the care is being delivered by family carers. Actually, just this morning, the BBC morning programme, they reported that a survey conducted by the National Care Forum suggested that many care providers now are unable to take on new clients due to these demands. And this, of course, can put huge strain on families. Often the care of an individual will fall to just one family carer. They can become focused on their loved one's needs, managing from day to day, and then they can neglect their own health needs. Research has shown that caring for others can have a major impact on a person's health and well-being. The UK survey conducted last year has shown that 72% of the carers that responded were unable to have any breaks from their caring role during the pandemic. Carers often report of isolation as they are unable to leave their loved one and meet the family and friends that they used to. It's important to highlight that everyone needs a break. No one person can meet the care needs of their loved one independently. This is why we have decided to release the TENA SmartCare Family Care app into the UK market now, in advance to the launch of the other TENA SmartCare innovations. The TENA SmartCare Family Care app allows for the creation of a care team of up to 10 members. It provides a communication link between that team, so everyone is aware of the various tasks that are required to meet the needs of their loved one. The care tasks can be planned ahead and allocated to the team members using notes and reminders. And as the tasks are completed, they can be ticked off, so the care team are all kept up to date and aware of what's happening. There is also a useful section called Care Advice. This provides a direct access to a wealth of information for the family carer. It provides practical tips for managing a loved one's incontinence and hygiene needs, and information on the TENA products is also available, including a product selector and fitting videos. Another important function of the TENA SmartCare Family Care app is how it links to the TENA SmartCare Change Indicator. And this is an innovation we will be launching later in the year. Lindsey will discuss the functionality, features and benefits of this product shortly. The TENA SmartCare Family Care app is available to download now through the App Store or through Google Play. It is absolutely free to download and free to use. So we will now play a video to introduce you to the rest of the TENA SmartCare range, or the TENA SmartCare Change Indicator, I should say, because there's other products. And after the video, I will pass you over to Lindsey. Thank you.
For over 60 years, we at TENA have provided individualised continence care that makes a difference, and we're determined to stay in the lead to provide sustainable solutions that liberate people from a world compromised by incontinence. Both care homes and caregiving relatives face numerous challenges daily. Heavy workload and inefficient use of resources, to mention a few. Checking incontinence products too soon or too late result in unnecessary disruptions, compromising dignity and the well-being of residents and loved ones, and in worst case, skin irritations. By introducing the new TENA SmartCare Change Indicator, a sustainable and revolutionary digital health technology solution, TENA has taken incontinence care to the next level, providing dignifying care for elderly. With a reusable change indicator that is easily attached to the outside of the absorbent product, caregivers will receive notifications to their smartphone via the SmartCare application when it's time to consider change. The TENA SmartCare Change Indicator helps to ease the stress of uncertainty for caregivers, reducing the need for unnecessary checking, as well as helping improve daily practice at care homes. The TENA SmartCare Professional Care Dashboard for care homes provides a complete overview of data on notifications and product changes to facilitate planning and optimize routines. With TENA SmartCare Change Indicator, we provide a higher level of comfort and quality of life, increasing the overall well-being of loved ones and caregiving relatives, residents and caregivers, while also aiming to improve efficiency at your care home. TENA SmartCare Change Indicator adds to the range of digital solutions from TENA. TENA, the more we connect, the better we care.
So as you've seen in the video, the device provides benefits to users and carers alike. It is designed to support healthcare professionals and carers, but should not replace professional judgment. The TENA SmartCare Change Indicator will reduce the need for frequent manual checks, improve well-being and dignity of care home residents, and can improve job satisfaction of staff by offering individual care derived from patterns and statistics recorded in the professional dashboard, replacing a task-orientated pattern of care delivery. The use of the product is especially useful when caring for those who cannot reliably communicate their needs. The Change Indicator is a sustainable solution to help optimise product consumption and links into the TENA Protects programme that sets out a goal to reduce our carbon footprint by 50% by 2030, making a better mark on the planet. TENA has always prided itself on its approach to protecting people, and it is our responsibility to protect the planet. As you can see from the illustration, the device can be used in the community setting via the Family Care app that Ashley has just introduced, or in the care home setting via the professional app and dashboard. The TENA SmartCare Change Indicator attaches to the outside of existing textile-backed TENA products, so there is no need to purchase any new disposable product lines. The benefit of this is that the device can be started on an individual at any point. The Change Indicator will detect saturation levels of urine within our TENA products and will send a notification to the carer's smart device indicating whether the product is okay, the product has some urine present, or it's time to consider a change. The device currently does not detect feces. The solution consists of 3 parts: a gateway in the residence room, a transmitter, and a change indicator strip. The strip is available in 3 lengths, and the selection will be dependent upon which TENA product is in use. The strip should last up to 12 weeks of continuous use before it needs to be replaced. Strips can be cleaned using any alcohol-based wipe and should always be cleaned with the device fully intact. The change indicator should be fitted to the TENA product before it is fitted to the wearer. We have developed a comprehensive support materials for the solution in the form of written literature and online training packages. Globally, we have a team of product specialists to support professionals and care homes in the application of the solution. But it's really important to say that any decision to commence a medical device must be made following a comprehensive individual patient assessment. The solution was launched last year in Europe and has been evaluated across a number of settings, and the feedback today is overwhelmingly positive, with staff providing testimonials. For example, the Director of Nursing at Valley Elder Care felt that the solution presented a real benefit to the team during the night, leaving them feeling more accomplished by the end of the shift. A carer named Ruby, she really liked how easy it is to use, and let's face it, if a solution isn't user-friendly, then more often than not, it will be discarded before too long. A care home in the Netherlands reported a 17% reduction in products and a 31% less product leakage. It is this reduction in waste and products that we can link directly to our sustainability goals. The dashboard used by the care home managers will provide them with the visual evidence of the value of the digital solution in both efficiency and economic benefits.
So that brings us to the end of our virtual lunch meeting. Thank you so much for joining us today. And just to recap on the session, the TENA SmartCare Family Care app is currently available for free to download through the App Store or through Google Play. We hope you agree that it will be a useful communication tool to help assist those family care teams. And we hope that you will also be able to share that with your caseload, your patients, so they know it is available to them. The TENA SmartCare Change Indicator will be available later in the year. This can be used in both the community and care home setting with the use of either the TENA SmartCare Family Care app or the TENA SmartCare Pro app. For more information on the TENA SmartCare innovations, please follow the links displayed. Of course, your local Essity account manager will also be able to assist. And if you would like to contact, I'll say that again. If you would like to contact us again directly or want more information, then please email us on hcmarketing@essity.com. And we really would welcome any feedback on our new innovations, because of course this will help us develop our products further and make sure that we are meeting the needs of our end users and for yourselves, of course. Look out for further information on the TENA SmartCare range across our social media channels. And thank you again for attending.
Brilliant, thank you guys. That was really interesting. Really good session. We've had quite a few comments and questions come through, and we've had quite a few people watching live. So thank you everyone for watching. We'll now move on to the live Q&A, and then we'll be posting links to things like certificates and stuff at the end of the live Q&A. Do continue to submit any questions you've got for today's speakers, and we'll get through as many as possible. Okay, so the first question, is my data secure and protected?
I'll take that one. So yeah, Essity, of course, we take the data privacy seriously. All the processing of personal data, irrespective of whether we are the controller processor, is done in accordance with the application data protection rules, GDPR. So yes, we're absolutely, it is completely secure, and we follow all the guidance.
Brilliant, thank you. So this one for you, Lindsey. Which TENA absorbent products can I use with the change indicator?
You can actually use the change indicator on any of our TENA textile-backed products. So our TENA Comfort, TENA Slip, TENA Pant, TENA Flex. So any of the breathable back sheet products.
Fantastic, thank you. Back to you, Ashley. Can I use any smartphone?
Yeah, you can. Well, you need to use Android phones, so 7.0 or later, or Apple phones, and iOS 11 or later. And you can tell I'm only into the technical data there, aren't you?
And I mean, I think most modern day phones basically.
Yeah, exactly. Yeah, not the old Nokia bricks.
Yeah. Okay, back to you, Lindsey. Does the change indicator only work with TENA absorbent products?
Yes, at the moment, the algorithms are built and validated for the TENA product range, so yes.
Fantastic, thank you. Question number 5. I care for 2 persons. Can I connect both in the same app?
So, well, we need to be specific here. So for the family care app, no. It is at the moment, as the functionality stands, it is centered around that one loved one, that one person, and the care team. So up to 10 members can be linked to that care team, and they can support that one loved person. Of course, for the TENA SmartCare Pro app, that can be set up to multiple carers and for multiple patients, and that's where you have that dashboard facility.
Perfect, thank you very much. On to question number 6. My loved one walks around quite a lot in her house. Can I add another gateway to make sure we are always connected?
Yes, you can add another gateway. The gateway range is approximately 10 meters. So if you live in a property where your loved one can wander out of that 10 meters, then yes, you would need a second gateway. and they would be installed exactly the same way that you've installed your initial one. So yes, you can have multiple gateways.
Brilliant, thank you. Next question, does the TENA SmartCare Family Care app cost anything?
No, it's absolutely free to use. Yeah, free to download.
Brilliant. It's always good to hear.
It's not, it's the same. It's unusual, isn't it? But yeah, it's completely free to use and download.
Yeah, definitely. On to the next one then. So do I need Wi-Fi at home in order to use the change indicator? One for you, Lindsay.
No, you don't need Wi-Fi. You don't need Wi-Fi. The system communicates between itself, so no Wi-Fi.
Perfect, nice and easy, that one. And can I use the change indicator when we go outside for a walk?
No, as we've just said in the earlier question, the range between the change indicator and the gateways is 10 metres. So if you were leaving your house, then unfortunately, no, at this stage, you couldn't get the signal that far. So that would be a no if you're going outside the house. Okay,
perfect. Next question is can I switch off notifications if I'm away on holiday?
Yeah. So on the app, there is a facility. So the TENA SmartCare Family Care app, again, being specific because of different apps. But yes, that you can turn the notifications off on that. But of course, you've got to remember to turn them back on again when you get home.
Yeah, of course. Next one for you again, Ashley. This one from Rebecca. She asks, can the device and app be used in a care home setting for auditing use?
Yeah, so for the TENA SmartCare Pro app and the dashboard, I mean, that is another one of the benefits of using a device. So not only will you get the notifications through on looking at when the device needs to be changed, or when, sorry, not the device, when the product needs to be changed, but also you can actually look at response times. So you can see when the device has indicated that the product needs to be looked at, it will then time between how long it takes for a carer to actually reach that patient and to look at the patient, or resident, I should say. So yes, it really can structure care. So definitely, yeah, can be used for auditing purposes.
Fantastic, thank you. Next question, will I be notified when it's time to replace the sensor strip?
Is that to me, that one?
Yes, sorry.
We both could answer it, really, could we? We're just like, we're being picky, aren't we, Lindsay?
Yes, if you don't mind.
No, you won't be notified. However, you will automatically receive sensor strips to refill in advance of them expiring. So although you won't be officially notified, you will go on to a regular programme to receive replacement strips.
Brilliant, thank you. Another one for you, Lindsay. This one's from Kelly. Will this product ever be used in the hospital setting, especially for the elderly patients who cannot communicate their needs and therefore preserving some of their dignity?
I would say it potentially has a place in the acute care setting, and it is something that we will certainly be looking at in the future. So yeah, watch this space. I think it's definitely got a place in the acute care setting.
Brilliant, thank you. Again, sorry for you, Lindsay. How long do the change indicator batteries last, and can they be replaced?
Yeah, so the batteries inside the transmitter, they will last for approximately 3 months, and they can be replaced. They simply pop in and out, but we would recommend that you use the batteries that TENA recommend, so that you get the best efficiency really out of the transmitter. And we wouldn't recommend that you use things like rechargeable batteries. So yeah, approximately 3 months, but we'd recommend that it's the CR2032 batteries that we would recommend that you use within the transmitter.
And how long would the transmitter itself last?
The transmitter itself will last 2 years. So yeah, you will need to replenish the batteries, but the actual device itself, unless you are a bit heavy-handed changing the batteries and you could damage it inside. But yeah, 2 years the transmitter will last.
Okay, brilliant. Back to you, Ashley. how can I contact TENA to share my feedback and ideas on how to improve the change indicator?
Well, there's a few ways. I mean, if you download the app, then of course you can, there's a help section in the app as well, so you can directly contact us there. Obviously use the email address that I mentioned before, and if you go onto the web page as well, there are various links that you can use to contact us directly.
Brilliant, thank you. Another one for you, Ashley, from Donna this time. Will there be a device that can detect fecal incontinence?
Yeah, so that is certainly a development that we are looking at. So hopefully in the coming years that will be available. But as it stands at the moment, it does not detect feces.
Okay, brilliant. So I've got a couple more questions, I think, coming through.
Okay.
If you bear with me. Some really good insightful answers so far, so thank you for
thank
those.
you. Quick fired.
Thank you everyone for submitting your questions as well. You can keep submitting them. If we don't get through all of them, then we will try and answer them in the next few days as well. They might not be on the live Q&A, but we'll answer them in the comments section anyway. Another question's just come through. So I care for 2 persons. Can I connect 2 care teams in the app?
Okay, so I'll answer that one again. So is that similar to before? You care for 2 people. I mean, if you're using the TENA SmartCare family care app, you can only link it into that to 1 person, and you would only be able to have 1 care team for that person. For the family care, for the TENA SmartCare Pro app, again, you can have multiple residents and multiple teams. So I don't know whether that answers the question.
No, that's great. I think we had a very similar question early on, but no, that's great. So I think that might be all the questions for now. Thank you both so much for all your answers.
No, thank you.
Really insightful, great presentations, some really interesting videos as well. We will post some more information in the comments section about the TENA SmartCare Family Care app and the TENA SmartCare Change Indicator. You can also contact Essity on hcmarketing@essity.com. That link should also be in the comments section. So if you have a look in there, you should be able to download to get all the information for that. It'll also be on the slides at the moment for you. The certificate link should be on the screen and in the comments section as well. Make sure you download that. That can go towards your revalidation. And also the recording for this video and the slides will also be available on our website in the next sort of 24 hours. You can watch this video back at any time on our Facebook page or go and watch it on our website. That website is jcn.co.uk, and you just click on the Facebook tab in the top right corner. Make sure you follow our Facebook pages, all of our Facebook pages, so JCN, GPN and Wound Care Today, so you don't miss any of these events. We've got lots coming up over the next year, and we're really excited to bring those to you as well. We're also back in March for our we're in the middle of doing our JCN events, our live events. So have a look on our website under the events tab. There's lots of different events around the country. I think our next one is near London. So have a look at that, and we'd love to see some of you there. That's all from us. We will see you next time. Thank you very much and enjoy the rest of your day. Cheers.